Are you searching for a comprehensive guide to understand the benefits and uses of Albuterol Sulfate HFA Inhalation Aerosol? In this video, we will walk you through everything you need to know about this widely used medication. Albuterol Sulfate HFA Inhalation Aerosol is a medication commonly prescribed for the treatment of asthma and other respiratory conditions. It belongs to a class of drugs called bronchodilators, which work by relaxing and opening up the airways, making it easier to breathe. In this comprehensive guide, we will cover the various benefits of Albuterol Sulfate HFA Inhalation Aerosol, including its efficacy in relieving symptoms such as wheezing, shortness of breath, and chest tightness. We will also explore its usage in different age groups, discussing the appropriate dosage for adults and children. Whether you are a healthcare professional looking to expand your knowledge or a patient seeking information about this medication, this guide has got you covered. Stay tuned to discover how Albuterol Sulfate HFA Inhalation Aerosol can improve your respiratory health and enhance your quality of life. What is Albuterol Sulfate HFA Inhalation Aerosol? Albuterol Sulfate HFA Inhalation Aerosol is a medication used to treat respiratory conditions such as asthma, chronic obstructive pulmonary disease, COPD, and exercise-induced bronchoconstriction. It is available in the form of an inhaler, which delivers the medication directly to the lungs. The active ingredient in Albuterol Sulfate HFA Inhalation Aerosol is albuterol sulfate, a bronchodilator that works by relaxing the muscles in the airways and opening up the air passages. This allows for easier breathing and provides relief from symptoms such as wheezing, coughing, and shortness of breath. The inhaler is designed to deliver a measured dose of the medication with each inhalation. It is important to follow the instructions provided by your healthcare provider or the product label to ensure proper usage and maximum effectiveness. Albuterol Sulfate HFA Inhalation Aerosol is available by prescription only, and the dosage and frequency of use may vary depending on the severity of your condition and your individual response to the medication. It is important to consult with your healthcare provider to determine the appropriate dosage for you. How does Albuterol Sulfate HFA Inhalation Aerosol work? Albuterol Sulfate HFA Inhalation Aerosol works by stimulating the beta-2 receptors in the smooth muscles of the airways. When these receptors are activated, they cause the muscles to relax, allowing the airways to widen and making it easier to breathe. The medication is delivered directly to the lungs through the inhaler, providing quick relief from symptoms. The effects of Albuterol Sulfate HFA Inhalation Aerosol can be felt within minutes after inhalation and can last for several hours. In addition to its bronchodilator effects, Albuterol Sulfate HFA Inhalation Aerosol also has anti-inflammatory properties. It helps reduce inflammation in the airways, which can further improve breathing and relieve symptoms. It is important to note that while Albuterol Sulfate HFA Inhalation Aerosol provides immediate relief from symptoms, it does not treat the underlying cause of the respiratory condition. Therefore, it is important to continue using the medication as prescribed by your healthcare provider and to follow any other treatment plans recommended for your condition. Common uses of Albuterol Sulfate HFA Inhalation Aerosol. Albuterol Sulfate HFA Inhalation Aerosol is primarily used for the treatment of asthma, a chronic respiratory condition characterized by inflammation and narrowing of the airways. It is also commonly used to manage symptoms of other respiratory conditions such as COPD and exercise-induced bronchoconstriction. For individuals with asthma, Albuterol Sulfate HFA Inhalation Aerosol can provide quick relief from symptoms during asthma attacks or flare-ups. It can help alleviate wheezing, shortness of breath, chest tightness, and coughing, allowing individuals to breathe more easily. In addition to its use in acute asthma management, Albuterol Sulfate HFA Inhalation Aerosol can also be used as a preventive medication. It can be prescribed for individuals with persistent asthma to be used on a regular basis to help prevent asthma attacks and maintain control of their symptoms. Furthermore, Albuterol Sulfate HFA Inhalation Aerosol may be prescribed for individuals with COPD, a progressive lung disease that causes airflow limitation. It can help improve breathing and reduce symptoms such as coughing and shortness of breath. Exercise-induced bronchoconstriction, also known as exercise-induced asthma, is another condition where Albuterol Sulfate HFA Inhalation Aerosol can be beneficial. It can be used prior to physical activity to prevent or reduce symptoms that occur during or after exercise. Overall, Albuterol Sulfate HFA Inhalation Aerosol is a versatile medication that can provide relief for a range of respiratory conditions. Its quick onset of action and effectiveness make it a popular choice for both acute symptom relief and long-term management. Benefits of Albuterol Sulfate HFA Inhalation Aerosol. The benefits of Albuterol Sulfate HFA Inhalation Aerosol are numerous and can greatly improve the quality of life for individuals with respiratory conditions. Here are some of the key benefits. Immediate symptom relief. Albuterol Sulfate HFA Inhalation Aerosol provides quick relief from symptoms such as wheezing, shortness of breath, and chest tightness. Its fast-acting nature makes it an effective choice for managing acute symptoms during asthma attacks or flare-ups. Improved lung function. By relaxing the muscles in the airways, Albuterol Sulfate HFA Inhalation Aerosol helps widen the air passages, allowing for improved airflow and better lung function. This can result in easier breathing and reduced respiratory distress. Prevention of exercise-induced symptoms. For individuals with exercise-induced bronchoconstriction, Albuterol Sulfate HFA Inhalation Aerosol can be used as a preventive measure. By using the inhaler prior to physical activity, it can help prevent or reduce symptoms that occur during or after exercise, allowing individuals to participate in physical activity without respiratory limitations. Long-term symptom control. Albuterol Sulfate HFA Inhalation Aerosol can be used on a regular basis to maintain control of symptoms for individuals with persistent asthma or COPD. By using the medication as prescribed, individuals can experience fewer asthma attacks or flare-ups and have better overall respiratory health. Ease of use. The inhaler form of Albuterol Sulfate HFA Inhalation Aerosol is easy to use and convenient for individuals of all ages. It allows for precise dosing and targeted delivery of the medication to the lungs. The compact size of the inhaler makes it portable, enabling individuals to carry it with them for immediate use whenever needed. Understanding the benefits of Albuterol Sulfate HFA Inhalation Aerosol can help individuals make informed decisions about their respiratory health. Whether it is for acute symptom relief, long-term management, or preventive measures, this medication offers significant advantages for individuals with respiratory conditions. Understanding the side effects of Albuterol Sulfate HFA Inhalation Aerosol. Like any medication, Albuterol Sulfate HFA Inhalation Aerosol can cause side effects in some individuals. However, it is important to note that not everyone will experience side effects, and the severity and frequency of side effects can vary from person to person. Common side effects of Albuterol Sulfate HFA Inhalation Aerosol may include tremors. Some individuals may experience mild trembling or shaking of the hands or other parts of the body. This side effect is usually temporary and resolves on its own. Nervousness. Albuterol Sulfate HFA Inhalation Aerosol can sometimes cause feelings of restlessness or nervousness. This may manifest as increased heart rate, irritability, or difficulty sleeping. Headache. Headaches are a relatively common side effect of Albuterol Sulfate HFA Inhalation Aerosol. They are usually mild and temporary. Muscle cramps. In some cases, individuals may experience muscle cramps or muscle weakness as a side effect of the medication. These symptoms are usually transient and resolve without intervention. Dry mouth or throat. Albuterol Sulfate HFA Inhalation Aerosol can cause dryness of the mouth or throat, leading to thirst or discomfort. Staying hydrated and drinking plenty of fluids can help alleviate this side effect. It is important to consult with your healthcare provider if you experience any side effects while using Albuterol Sulfate HFA Inhalation Aerosol. They can provide guidance on managing side effects or recommend alternative treatment options if necessary. In rare cases, Albuterol Sulfate HFA Inhalation Aerosol can cause more serious side effects that require immediate medical attention. These may include chest pain or tightness. If you experience chest pain or tightness after using Albuterol Sulfate HFA Inhalation Aerosol, it is important to seek medical attention immediately, as this may indicate a more severe reaction. Irregular heartbeat. Albuterol Sulfate HFA Inhalation Aerosol can sometimes cause changes in heart rhythm, leading to an irregular heartbeat. If you experience palpitations, a rapid or pounding heartbeat, or lightheadedness, it is important to seek medical help. Allergic reactions. While rare, some individuals may experience allergic reactions to Albuterol Sulfate HFA Inhalation Aerosol. Symptoms of an allergic reaction may include hives, itching, swelling, difficulty breathing, or a rash. If you experience any of these symptoms, seek immediate medical attention. It is important to read and understand the product label and package insert for Albuterol Sulfate HFA Inhalation Aerosol, as it contains important safety information and instructions for use. If you have any concerns or questions about the side effects of this medication, consult with your healthcare provider for further guidance. Dosage and administration of Albuterol Sulfate HFA Inhalation Aerosol. The dosage of Albuterol Sulfate HFA Inhalation Aerosol may vary depending on the individual's age, the severity of the respiratory condition, and the response to the medication. It is important to follow the prescribed dosage provided by your healthcare provider. For adults and adolescents aged 12 years and older, the usual starting dose is 2 inhalations, 90 mcg, every 4 to 6 hours as needed. The maximum daily dose should not exceed 12 inhalations, 720 mcg, in a 24-hour period. For children aged 4 to 11 years, the usual starting dose is 1 to 2 inhalations, 90 to 180 mcg, every 4 to 6 hours as needed. The maximum daily dose should not exceed 12 inhalations, 720 mcg, in a 24-hour period. It is important to note that the dosage may be adjusted based on the individual's response to the medication and the severity of the respiratory symptoms. Your healthcare provider will determine the appropriate dosage for you or your child based on these factors. To use Albuterol Sulfate HFA Inhalation Aerosol, follow these steps. Remove the cap from the inhaler and shake it well to ensure proper mixing of the medication. Breathe out fully, away from the inhaler, to empty the lungs. Hold the inhaler upright and place the mouthpiece in your mouth, forming a tight seal with your lips. Start breathing in slowly and deeply through your mouth, and at the same time, press down firmly on the canister to release a puff of medication. Continue to inhale deeply and slowly for a few seconds to ensure the medication reaches the lungs. Hold your breath for 10 seconds, or as long as comfortable, and then exhale slowly. If another dose is needed, wait at least 1 minute before repeating the steps. After use, replace the cap on the inhaler to protect it from moisture and dust. It is important to clean the mouthpiece of the inhaler regularly to prevent clogging and ensure proper functioning. Follow the instructions provided by the manufacturer for cleaning and maintenance. If you are unsure about the correct usage or have any questions about the dosage or administration of Albuterol Sulfate HFA Inhalation Aerosol, consult with your healthcare provider or pharmacist for guidance. Precautions and contraindications for using Albuterol Sulfate HFA Inhalation Aerosol. While Albuterol Sulfate HFA Inhalation Aerosol is generally safe and well tolerated, there are some precautions and contraindications to be aware of before using this medication. Allergies. If you have a known allergy to Albuterol Sulfate or any other ingredients in Albuterol Sulfate HFA Inhalation Aerosol, you should not use this medication. Allergic reactions can be severe and potentially life-threatening. Cardiovascular conditions. Albuterol Sulfate HFA Inhalation Aerosol can cause changes in heart rate and blood pressure. If you have a history of heart disease, high blood pressure, arrhythmias, or other cardiovascular conditions, it is important to discuss the risks and benefits of using this medication with your healthcare provider. Diabetes. Albuterol Sulfate HFA Inhalation Aerosol can affect blood glucose levels, so individuals with diabetes should monitor their blood sugar closely while using this medication. Thyroid disorders. Albuterol Sulfate HFA Inhalation Aerosol can potentially exacerbate symptoms of hyperthyroidism or other thyroid disorders. If you have a thyroid condition, it is important to discuss the use of this medication with your healthcare provider. Thanks for watching.